Hi, and good evening. My name is Coprice Jones, and I am here with the Gift House today. And I have a special guest, which is Dr. Singh. And we will be talking about health promotion among racial and ethnic minority men. How are you, Dr. Singh?
Good, Caprice. How are you?
Great. Thank you for being my guest today.
Thank you for having me.
You're welcome. So we're talking about the racial ethnic minority men. What is intended when we talk about that?
So this study that we're working on is basically on the health disparities among minority men.
Okay.
And according to the U.S. Census Bureau, there are about 3 million people in the city of Chicago. Now, out of these 3 million people, 402,854 are African American males. Now, out of these males, 10% have diabetes. That's 80,000 people.
That's a lot of men.
Ridiculous. It is. I mean, this is unacceptable. There should not be this many people suffering from diabetes. Now, when we look at hypertension, there's a 23% rate in the African American men. These numbers are just appalling. I mean, they just upset me because they shouldn't be. I don't even want to call them diseases because these are lifestyle changes. If we can work on tweaking our lifestyle, these wouldn't even exist in our community.
Dr. Singh, what got you involved in this? Because as we see, we're dealing with minorities. Why is this so important to you?
So we also talk about other minorities. There's African Americans, there's Hispanics, there's Asian Indians, which is my community. So we're also involved in the same group. So this is why it's important to me. Also, I noticed that when I was doing my clinical rotations in the city of Chicago, I also did some in the suburbs. And I noticed there was a vast difference in the patient population. The patients in the suburbs were so much more likely to work in parallel with the doctor. They wanted to get help with their whatever diseases they were suffering from. They asked more questions. They did their own research. And I didn't see that so much in the city. So that's kind of what drew me towards this study. Now, going back to the study, the numbers for the Hispanic males are just about the same. There's about 399,000 Hispanic males. And out of those, there's 9% are diabetic, 14% are obese, and 23% have high blood pressure. These numbers are just outrageous.
Wow, that's a lot.
Yeah, so our main goal is to focus on the causes of these diseases. What's causing them? What is preventing Mr. Smith from eating healthy? Is it a food? Does he live in a food desert? Can he not afford it? Why is he not exercising? Is he working double shifts and he just doesn't have time? Or are there some other reasons that he possibly can't exercise? Are there some pains? Maybe he's having arthritis or any sort of body pain. There are several reasons, so we have to go in on each client or each patient that comes to us and figure out the root cause, and that will help us as a community improve and get rid of these percentages. Our goal is to reduce these percentages by attacking the cause.
Now that you brought up the percentage, I noticed you're saying percentage a lot. Is this a research? Is this a grant? Tell me a little bit more about the percentages that you're talking about, and why are you talking so much in percentages? Is it broken down in some type of research study, or can you tell us a little bit about that?
So this is a grant. We're working towards a grant, but it is a research on each of these minority communities.
Okay.
So there are some other health disparities I would like to talk about. The other health disparities that we came across were sedentary lifestyle. Now, when we look at the sedentary lifestyle, that's when people are sitting for like 90% of the time. You're sitting more than, you're not exercising much. So we saw that in the Asian population and the Pacific Islanders, that group is about 70,000 people. 34% of them had a sedentary lifestyle, and that's just ridiculous, because sedentary lifestyle can lead to heart attacks. You have a 40%.
So just sitting can lead to heart attacks? Doing nothing?
Exactly.
Wow. I better get up and walk.
Yeah, so just sitting, you can get heart attacks, you can get colon cancer, because with colon cancer, what happens is when you're sitting, you're more prone to constipation. Now, with that chronic constipation, all of your toxins are just sitting inside you for a longer period of time, and that's what eventually leads to colon cancer. Back to heart attacks, if you have a sedentary lifestyle, and then you also have diabetes and hypertension, all of these, your chance of getting a heart attack is just going to skyrocket. So, I mean, these are the issues that we are covering. The other health disparities we talk about are poor nutrition. So when we look at poor nutrition, in each of the minority communities, so far I mentioned African Americans, there's Hispanics, there's Asians, Pacific Islanders, and Native Americans and American Indians. So Alaskan Native, sorry. So out of all of these, 8% have a poor nutrition, but Asians have 12% poor nutrition. So these percentages are very high, and we have to work to reduce them. Because what happens with poor nutrition is you're in a low energy state. And when you're in a low energy state, then you're just tired all the time, and you can't get your work done. And then you don't have energy getting to your brain. If you don't have energy getting to your brain, then you can't think clearly. So your day-to-day activities are just hindered. Now, not only does a low energy state affect your day-to-day activities, but it also can lead to cancer. What happened? Yeah, it's really weird, because what happens is you need ATP, which is another word for energy. You need that, your body uses that to hide the gene mutations that you could possibly have. If you're prone to certain diseases that are in your genes, your body, just naturally, ATP hides that, and you need a good diet to stay high in that. And so what happens is if you have low energy, then these genes are expressed more, and that leads to cancer.
So, Dr. Singh, that was great. Great information, and I love what you said. But how are we going to get this message across? How are you going to engage men that don't generally go and see a physician? How are you going to get them out into the community, into workshops, if they haven't? Are you going to ask their spouse to bring them, or are you going to hit different community avenues or workshops? How are you going to get the men that generally do not go to the doctors anyway? How are you going to entice them to come out to your program?
So it's more about understanding and communication, because we have to get across the gravity of the situation. Okay, so if you tell me, oh, Dr. Singh, I have diabetes, okay, and my sugars go up and down, and I don't really, I take my insulin sometimes I do, sometimes I don't, and I'm okay. I don't need to change my lifestyle. I don't need to exercise. I don't need to diet. I feel perfectly fine. But you might feel fine right now, but 10 years from now or 15 years from now, you're going to have a higher chance of all the complications of diabetes, such as limb amputations because of ulcers that can occur, and heart attacks or kidney disease, strokes, blindness.
Wow,
so all of these happen later on, but we have to work every day to take care of ourselves.
So the diseases lay dormant inside the men until they get sick or something, and they have a cold and go to the hospital, and they start running tests, and then they notice that they have these diseases?
Right.
Is that what you're saying?
Right. Well, So what happens is, let's say if there's someone who doesn't go regularly to the doctor, they don't go and have an annual physical, and you might not know that you're borderline diabetic, or you're borderline have high blood pressure. So you won't know that you can take care of it before you even get the disease. So you could have it for 6 months to a year before you have horrible symptoms. You'll have symptoms that tell you that you're diabetic, like you'll urinate a lot, or you'll get very thirsty or get headaches or like more flu-like symptoms occur when your sugar goes really, really high. So you can prevent these. We can prevent these from happening if with regular annual physicals.
Why do you think minority communities are at a disparity than any other community? Than I would say than the suburbs, or if we talk about Wilmette, Winnetka, why is it in the African community that these issues are so prevalent?
I think it's more of a lack of resources, maybe a lack of health education. So it could be a language barrier, and all of these little things play in. But we have to figure out. That's what we have to figure out.
Okay.
Like we want to talk to clients individually. We want to talk to patients individually, and that's how we figure out. What is the problem? Like why are their health behaviors the way they are?
So would there be literature and information that they will be able to understand, that it would not be just in medical terms that they do not understand? Because most people don't read it because they don't understand the medical language.
Right.
At the health fair, will you have information that they will be able to comprehend? Because comprehension, they need to be able to comprehend what they're reading. They can't have all these big medical words, and if they don't understand, they will take the paper and just throw it down. What are you going to do about that?
So we will have surveys to fill out. The surveys are confidential, and they're confidential, but they're anonymous, so we won't know who's filling them out.
Okay.
We don't ask for any personal information. So and yes, everything is in terms that you will understand, and they're not in medical terms. So yeah, those surveys will help us figure out where we need to focus.
How are we going to get these men involved? What are we going to do to get them out?
So we were thinking about going to community centers, going to city colleges and barbershops, just wherever these people hang out. Go into the community, invite them to our health fair. At our health fair, we're going to have healthcare workers. We'll have a phone number at hand, and anyone can call. We will provide them with a lot of educational information and resources for continuing education. So we have a lot of information available that we would love to share with you guys.
That sounds great. So we have a caller, so we'll go to the caller. Hello, caller.
Hello, great show.
Thank you.
I fit right into that demographic of men in a minority community who apparently is suffering with obesity. My body mass index is like 34, I think it is, and I'm like 5'10". But I feel healthy, I eat healthy, I'm active every day, and I don't have any symptoms where I'm diabetic or anything. But sure enough, sometimes I just run out of energy, and I'm just concerned here, like maybe what we're talking about is not a minority thing. Maybe it's just sort of, like the doctor said earlier, maybe it's just a situational thing. Like I live in a food desert, for crying out loud. I can't get healthy food without getting in my car, driving 5 miles to get food. So I guess that's my comment. My question is, I'm so confused about this body mass index thing. It makes no sense. I see people whose body mass indexes are way off the charts, and they don't look obese.
Right.
So can you explain how that's worked out and how that might tie into finding out whether or not I'm pre-diabetic or having issues with my health? Thanks.
Okay. So
good question, caller.
Yeah, that's a great question, and that's wonderful that you're exercising and you're trying the best that you can to do whatever you can. The best way to find out if you are diabetic is to come in, have a blood glucose. We'll check the blood glucose. We can refer you to doctors or clinics if you have any issues with finances or anything like that. Then we could definitely refer you to to a doctor
and a nutrition to help, to get him back.
But you said you're eating healthy, but then you're in that food desert, so that's the main problem for you.
So we have another caller on the line. Hello, caller.
Yes.
Hi.
Hi.
Your question?
Yes. Hi.
Hello.
Yes, I was wondering, a diabetic person, do the eyesight plays a part in that?
It does. Because what happens is, are you diabetic? Hello?
No, my friend is.
Your son is? Okay. Does he have type
Yes,
1?
my friend, I have a friend that
Uh-huh.
is a diabetic,
Okay. Is it type 1 or type 2 diabetes?
and he's saying sometimes he can't see good.
Okay. Okay. How long has he had diabetes?
How long have you had diabetes?
Uh, Maybe about 5 years,
Okay.
and he 5 years, but he do take the pills, but not the shots.
Okay, he takes pills, so maybe he's a type 2 diabetic? How old is he?
Yes,
Okay, how old is he?
77.
Okay. Caller, what I
He's
want you to
77.
Okay. What I want you to do is I want him to come into the gift house. Okay, you can call the number. We'll provide the number in a few minutes. I would like for him to come in and we could have a one-on-one counseling session and talk about his diabetes. And I think that's the best way we could work from it because I would love to know about his medical history and that way I could help him better. Okay?
Thank you, caller. That was a great call. So, people can come in and ask questions. Do you prefer them to bring like their medical history? Would you prefer them to bring all the medication they're taking?
Definitely. I would need all of the medical history, their medications, anything that they would like to provide that would be helpful for me. And if they like, we can refer them to any other doctors if they like. That would whatever they're more comfortable with.
Okay, and I want to put the information on the overhead. So if you want to come in and you want to sit down with our doctor, you will have the information. You can come to the gift house at 1309 South Kedzie. Our telephone number is area code 773-522-2420. If you want to email us, you can go to the gift house at sbcglobal.net, or you can go to our website at www.thegifthouse.org, and we will definitely get in touch with you. You don't have to be afraid. You can come in and we will give you a personal consultation. It'd just be a one-on-one in a private room, just you and Dr. Singh. So Dr. Singh, tell me, can female come in, ladies come in, or is this research study just for men at this point, at this particular point?
At this particular point, it's just for men. But if there are women who would like to come, we have information. The gift house has plenty of resources. We can always refer you to someone who would be a best fit for you.
Okay, so that's great. So what if they walk in with a significant other? Mm-hmm. She'll be able to sit down in the waiting area, or can he have her come in, or
whatever the patient is comfortable with. If they would like their spouse in the room, that's fine. They're welcome to wait outside. There's plenty of space. I mean, there's plenty of waiting areas. So
okay.
Whatever they're comfortable with.
And so when the men come in and we talk to them about whatever's ailing them, will you be able to refer them to a free clinic or refer them out to like a doctor if finances is a
Yes, we have plenty of resources
issue?
like I said before, plenty of resources for any sort of issues that you're having. If it's financial or just want to talk about something, you're welcome to come in at any time. Well, we probably need to make an appointment because but yeah.
So it sounds like we're really trying to get men back on track to trust the healthcare providers, because we see more that men do not go to the doctors versus the ladies, we always go to the doctors. You don't have to worry about it. We stub our toe, we go to the doctor. But we're trying to get men back on track, and the trust issue, that, in the African American men, I think they, don't trust the doctors for some particular reason, or they just overlook their ailments. Can you talk about trust and let everybody know that they're guided by the HIPAA law, and that will not be, any of their information will not be disclosed, because I think trust is one of the main issues.
Definitely. Whatever we discuss at the gift house, it stays confidential.
Okay.
Whatever you discuss with any other doctor and any other hospital or facility, any clinic you go to, everything is confidential. So there shouldn't be any reason, that shouldn't be an issue at all. But, Caprice, I would like to finish talking about the grant.
Okay.
So finish talking about the research. So I left off at sedentary lifestyle. We talked about poor nutrition and how that can lead to a low energy state, can lead to cancer. But we focus mainly on prostate cancer because we've seen 33,000 men, African American men, are affected by prostate cancer. And unfortunately, they're 2.5 times more likely to die from prostate cancer than their Caucasian men.
Okay.
So it could be genetics. It could be the chronic low energy state. We're not quite sure what it could be, but it's always good to get tested, and it's a little uncomfortable. I know we had a caller yesterday talking about how it was uncomfortable, but this is the best way to, this is actually one of the easiest ways for us to test patients.
Okay, before we wrap up, Dr. Singh, could you just give our viewers a list of all the diseases that we're focusing on with this particular grant?
Okay, so we focus on diabetes, hypertension, obesity, HIV and STDs, poor nutrition, sedentary lifestyle, unintentional and intentional injuries. So those are the main ones we focus on. We can talk quickly about HIV and STDs. So HIV, we noticed, was very prominent in the Hispanic and African American communities, but now we also saw that it's very prominent it's becoming more prominent in the Asian community and also the American Indian community. And this is the hardest one to tackle because a lot of people don't want to get tested. They're afraid. And that's totally understandable to be afraid. There's a cultural stigma associated with it. It could be because of fear of discrimination, or it could be because they don't want to bring shame to their families, whatever the reason is. But, unfortunately, it's just like diabetes and hypertension in the sense that it's a silent killer. You're not going to know that you have HIV for months and months until you have some symptoms.
So they can be tested for HIV at the gift house?
Yes, ma'am. They can. It's just a simple swab. That's all you need. It takes not even 10 seconds. So it's very simple to do, and it's just so important to get tested, especially if you're a high-risk patient, which would be gays, bisexuals, if you don't use condoms regularly, or if you have multiple sexual partners. So definitely very important because this virus will kill your immune cells, and you won't know until it's too late, until the symptoms show up, until the immune system goes completely down. You won't have any symptoms.
Okay, and I want you to know, because we're talking about HIV and STDs at the gift house, you can always get protection for males. They have condom, and for the female, we have female condoms. So please do not ever think that you cannot protect yourself. It's free. Nobody looks at you. We give you a bag of condom, and then you can go on your happy way. We have condoms for females, and we have condoms for male. So I want to wrap up, Dr. Singh, but I want the men to know that June 13th through 17th is Men Health Week, and I want you to be able to come out to the gift house. I will put the information up again before we wrap up. You can go to the gift house at 1309 South Kedzie. The telephone number is area code 773-222-2420, or you can also contact the Gift House at sbcglobal.net, or you can go to our website at www.thegifthouse.org. And Dr. Singh, I'm so happy that you were my guest today, and I hope you all enjoyed her. And we want to bring you back, and so we can continue to let men know the awareness out there that there's a place that they will help, that they can get help. And we want to be able to bring you back periodically just to touch bases, and if we have to talk about the grant as well and see how, that's moving along. I know it's going to take time, and I know that we're working diligently on it. And I just thank you, and thank you for being my guest.